Hi, everybody. I'm Debbie Montgomery Johnson, founder of the nonprofit The Woman Behind the Smile, and your host of Stand Up and Speak Up, a show that is about each and every one of us. Many of us have something we're hiding, something we're ashamed of, something not through no fault of our own or through our own making we keep hidden, and that in turn keeps us hidden from each other and the world. Good people go through terrible situations. Wise people know when and how to let it go. Everything that happens to us helps us grow, and while it may be hard to see it right away, the most important thing to do is to change your perception about your circumstances. Regardless of what your personal experiences or traumas have been, this showcase series is designed to ignite the light in you, as well as providing safe harbor, education, personal growth, and resources so that no matter where you are on your journey, you'll have the courage to move on when you're ready. Stand Up and Speak Up features ordinary people who've been through extraordinary situations and struggles and found the courage to step out from behind their smiles and speak up about their experiences and the lessons gleaned from those experiences. Everybody heals at a different pace, and we recognize that. So come on in, have a listen, and enjoy the ride at your own speed. It's a beautiful day in paradise, and I'm so excited today to have a very special guest friend of mine, Miss Sally Nisberg. Sally is down here in West Palm Beach area, and we've known each other for a few years. Long story on that one. But Miss Sally, are you here with me?
Yes.
Great.
Yes, I am.
Great to have you. And it's so funny because we've sat and talked about things over the years, and I've never had you on the show, and I'm thinking, oh my gosh, this is a perfect time to talk to Sally about Live Like Crazy and your mission, because October is Breast Cancer Awareness Month. So we're just going to jump right into this topic, Sally. But before we do that, I love to find out who my guests are, particularly today, because we have a lot of your family listening in. So can you tell me, where is Sally from, and a little bit about your family background?
Okay. Well, I was born and raised in New York, outside of the city, yet my husband and I moved to Florida over 20 years ago. We have 3 children and 6 grandchildren, all close by. I have been a child and family advocate my entire adult life. So for 40 years, I have devoted myself to being there with and for families in my community. And I do have an undergraduate in behavioral science. I have a graduate degree that I completed in my adult life in criminal justice here in Florida. And that all ties into the fact that when I was diagnosed with cancer, I received that in a manner as such that I stepped into, I knew that my advocacy would now be, extend to and primarily focus on survivors. Cancer it's a monster. And, when it happens to someone we love, it's horrible, but it is, when it happens to us, it's deafening. To hear the words "you have cancer" is deafening. And there's a fear that paralyzes us. So I knew that I was, as I would manage, my survival and my treatment and my surgeries, that on the other end of that, it would be so important to share my story, my message, and not to validate my own story, but to really to help others, to help them gain, their own sense, to make their own decisions, and and navigate their way through the disease.
Okay, we're going to continue on that, but let's go back to when you were little. You have brothers and sisters?
I do. I am
large
one
family?
of 7. I'm in a large Irish-Italian family. So,
where do you fall in the 7?
I just going there. I'm number 5, so I have 2 older sisters, followed by 2 brothers, and then a 6-year span between myself and then 2 younger brothers. So it was an interesting dynamic. But there's 7 of us, incredibly close, living all over the country, but certainly thread very tight.
When you were young, did you have a voice in the family, or did you kind of get wrapped in the middle because you were basically the middle child?
there you go. You kind of your ability to hone in is pretty remarkable, Deb. No, I was always the quiet one, and perhaps there was not a tremendous sense of security, internally, and perhaps it wasn't. That may not have been the family culture either. So it's interesting you say that, because I think many of my moments in my life have perhaps been a tap to strengthen myself and believe in myself and carry less fear. So thank you for asking.
Well, I asked that because the show is called Stand Up and Speak Up. And I know you're a lot like me, and I'm looking at your beautiful picture of you smiling, and it's the woman behind the smile, which is what many of us, most of us, do at some point in our lives. And so I was just curious, because of your advocacy work in the justice system too, what led you to getting a degree, master's degree in criminal justice?
It was one of two things as an adult, because as a victim advocate, I found that it would be of tremendous value to me to understand the system and how I could fit in and help and support victims along the way. So I had two choices. I was either going to go to law school, which is something that, I truly think, that I would love to do. But I think remaining kind of in the system and understanding that was allowing me to partner with attorneys, as I do day to day in our state attorney's office here in Palm Beach County, or with the Sheriff's Department since 2004. But I have a greater ability to assist my victims because I understand all the players on the field, the judges, the attorneys, and then with that behavioral science undergrad, I'm able to understand behaviors of the family members as I assessed where the victim, the child, is in their safest place in their life.
Did you have any personal experience with that? Kind of asking a
I had a tad.
question.
I am an adult child of an alcoholic. My father, until was an alcoholic, but by the grace of God, for the last at 40, he went into recovery. So I had 40 incredible years with a father and a gentleman and an advocate who gave back to those in his community. So perhaps to a large degree, witnessing what he chose to do with his addiction and witness those he helped may have fed into choices I've made as an advocate.
Okay, well, I wondered that because it's not something that we jump into. I know you and I have talked about this because of some experiences my youngest has had, and the justice system, the criminal justice system, is overwhelming as a family member. At least I found that there were no answers and there was no guidance for the parents.
And there is the exact link why Sally does what she does, because I am front and center and available to help people, and not just the victim, because oftentimes it's the parent or someone in their immediate life, or even and then if we extend that to a survivor. It's not always the breast cancer survivor; it's the caregiver. And I have an interesting story about an immediate experience I had after I published my book that I didn't expect, and has become quite an effort and focus of mine as an advocate, because it is, it's the family that is in a crisis. If you have someone in the criminal justice system, you're in a crisis. You are reacting. You really don't have the wherewithal to respond. You don't, there's so many moving parts, and just like breast cancer, because it is a crisis, and it can take a family down. It can take them, a family down one by one. and which is exactly why I do what I do, because those calls come in, and I can, you can actually allow someone at that point to exhale, and it's not, it's not an immediacy where you understand the system or you understand treatment or you understand your resources. What individuals or human beings discover, and that's what I work really tirelessly to do, is that one moment where an individual feels safe and trusts not only the system or the process, they trust themselves to make a decision. They don't, the energy that it takes to rely on others, and it's enormous. So to me, I find it so rewarding, to assist someone in just taking that first step, and that's whether it's through the legal system, through treatment and survival, or virtually through any crisis. Because today, a crisis is a crisis. It can be, your story, Deb. It can be financial loss. It can be issues with your job. It could be housing. It could be, a child with issues. It could be virtually anything. And when we step into a space quietly and invite someone to step in and, safely let them really feel and understand that we're just here to listen, just listen and understand what they're going through, how they're feeling. That's really the first inning, and that's where an individual will actually gain this sense of strength within to make a call, or to convey an information to someone, or to respond to someone and not react, because too often we find ourselves reacting because we are in unknown territory.
Exactly, and you hit it on the head there. And I found that knowledge is power and security. And at the beginning, to go back to your call, we're going to sort of skip around in this conversation, but to go back to that call, and it was in 2011. Can you walk us through your day?
Yes. Yeah, and thank you for that, because, wow, it's amazing how these moments come back to me in conversation. But and I'll quickly note this, and I don't want to spend a lot of time. But at the moment that I detected a tumor, I was in crisis. My family, had a situation where, my son was in a horrible accident, and that was in October of 2010, and it was, it was local. I'm a mommy, and he's my adult son, but he was, his life was hanging on a thread, and I was it was all consuming. So in a coma for quite a while. But the point is, Sally lays down in bed one night, and for whatever reason, my hand on my chest, and I felt a tumor that felt like a AA battery. It was not this small tumor. And I had my annual mammogram coming up the first week of December. And because of this moment, in my life that was, was just horrible, and the fact that I had a mammogram due in 2 months, I made the immediate decision to wait. I didn't mention it even to my husband. I was radio silent on what I felt. So we on this call can only imagine that was self-imposed on myself. I wasn't thinking clearly to start with, but now this was compounded because Sally made the decision not to tell anyone, because probably was nothing. So I chose not to do that. And fast forward to 2 months, and I did not tell anyone. I went and had my mammogram, and again, I walked into the radiologist's office. There was a questionnaire, which today, with HIPAA laws and all, we all expect that questionnaire. It's very private, and you complete, and you're instructed to hand it to the technician. Well, I kind of lightly filled that form out, and because I'm a people person. I'm just going to connect with this technician, and I'm going to share my story and, and show her what I felt and what have you. So I hand her the material. I chatted the entire time. So in my head, we connected, and she had all my information. She did the test, and it was routine, and I was told, and we all know, as women, and here in my 60s, we've gotten, enough of them, that I would get a call if there was an issue. But other than that, I would be receiving, a letter from them if there were no issues. Well, I waited, and again, parallel to this is managing, my son, who was in a trauma unit for weeks. I could not believe that I opened the mailbox one day and here's a letter telling me that my mammogram was clear and reminding me to please return next year. Well, that's when Sally went into gear. That's when I picked up the phone and I called my internist, and I said, Dr. Mark, this cannot be right. I'm feeling something in my breast. The test, the mammogram is detecting nothing. I need to have additional tests. I need a sonogram. I didn't go to a biopsy at that point. I wasn't even familiar at that point. He made the call. He prescribed my next test, and I went in. I had the sonogram, and the radiologist did the biopsy. And I left there. And then another collision is, and this is only, within 5 days, my son was had been discharged but was going back for ambulatory surgery one morning. And along with his girlfriend and myself, it had to be 6:30 in the morning. I drove to the hospital to meet my son just before his surgery. But I did have, I had other things to do that day as well. My husband was expected to leave on a business trip, and I committed to be back here at our home by 8:30 to pick him up. And my son was on his way and into surgery, and I said I would be gone for all of 45 minutes. I get in my car, and within moments, what could happen in a moment? We do things so routinely in life. And our only focus is what we're doing next, not what happens in between or what we're feeling or doing. We're always oblivious to what's going on in our life when we have things to do. My phone then rang as I'm in the car, and it is a Monday morning. It's only about 8:15, and it's my internist, and he's a remarkable professional, but he's a human being beyond. And he said, Sal, where are you? And I said, I'm driving from the hospital home to pick Jay up. And he said, pull over. And I said, okay. And I calmed myself down. I think the world went silent. And I pulled my car over, and he said, Sal, your tumor is cancerous, and you need to see a specialist immediately. Where do you want to go? And I heard nothing. It was like I was in this tank by myself. And my immediate response is, where would you send your wife? Where? And he shared a doctor's name, and I made the appointment. And by the time I had gotten home, 10 minutes later, he had called my husband, who was just immobile, in a chair, just immobile. But that's where it began, and Deb, and again, as I circle back to your story, there isn't one of us on this planet who has not had a crisis, or a situation, because they will happen again and again. It's bam. You think that you're blessed, life is good, you're content, and then out of nowhere, the rug is, it's just slipped out from under you. And, and I, at that moment, my hopes were dashed and my faith was shaken. I mean, I was incapable. And I think I believe there isn't a survivor that I speak to today who isn't in that moment. They are desperate. not only for help, but what we don't realize is really it all begins with ourselves. We need to reach there in order to really move forward, because to continually have people do things for us, that's a rescue. That's not literally helping someone.
So at this point, you went on autopilot, I would imagine. I mean,
Indeed.
That's how I felt for like 6 months. So how did you proceed then? Did your doctor help you really well? Did you reach out to the cancer organizations? Where did you go? I'm thinking of another woman. Say, I got the call today. Where would I go, Sally? Except I would call you. But.
I really, and I must say, and we all have to really be aware and accept the fact that our behaviors are different. And I carry that every day with whomever I'm speaking to. You have to recognize someone else, and respect someone else's. We all react differently. Sally, in particular, I mean, I arrived at home. I mean, my husband and I were in shock, as we all are with, any crisis in our lives. But I do go into, as you say, Deb, autopilot, because it's interesting. I saw the breast cancer surgeon who, along with my oncologist, worked, in tandem to diagnose what type of tumor, what type of cancer I had. And he is, he's the professional who removed that tumor. But again, I'll never forget, my husband and I walked into this very, very small room, which barely fit my surgeon, his physician's assistant, myself, and my husband. And I laid down, and he was just looking above me, and he validated, my pathology, and said, you indeed have, although it's stage 2, it's highly irregular, hence it wasn't diagnosed on the mammography, ductal carcinoma, and very fast growing. We need to remove that as fast as possible. And when I tell you there was no commotion in that room, I guess I was, I was leading that moment, and, skillfully they just let me be. But I didn't say a word. And I could feel, if I close my eyes, I can feel his physician's assistant just kind of, holding and rubbing my shoulder. But he just looked at me and said, Sally, are you okay? And I looked at every one of them, made eye contact with every one of them. I said, yeah, I am. What is the plan? But that's me. Mm-hmm. We're all going to react to that differently. But I needed not only to know the plan, I was going to be in control. And but my husband, I'm very blessed, was by my side, every inch of the way, because we think we're cognizant and we're in the moment and we're able to digest information and process that information and understand, every resource. I certainly did not, but my husband was able to perhaps calm me down, and I guess that's, something he always does.
As you were speaking, control was the word that came to me. That's what I do, to try to control myself by controlling the situation. But at some point, you fall apart. You can only hide behind that smile for so long. So this whole thing went relatively quickly. You had the surgery quickly. What was what happened after the surgery? What was your recovery like?
It was hard. I didn't make the wisest decisions along the way. I chose to have a a mastectomy, bilateral, and so on the very same day, in the very same procedure, my tumor was removed. My surgery was about 8 hours because I did have issues, that surfaced with blood pressure and other, vital signs that they had to manage. But I had an implant put in, and my head was in the wrong direction. But I look back, we make the best decisions that we can at a given moment. And the sooner we own those decisions and not, if that decision is not, ideally work for us, for each individual, we tend to point the finger or blame someone else. The sooner we gain the ability to own a decision, the better standing we have, to move forward and understand how we're going to get through this and how we have to manage that.
Is it a recommended practice after a mastectomy to do the reconstructive?
Many different theories, and I grapple with that every day. And even currently, within the last 24 hours, I had a conversation with a new survivor who actually I connected with after, her mastectomy and what have you. But so to answer your question, there's many different theories. There are surgeons out there. There are very progressive surgeons, and by the way, there's a high percentage of women who fare very well with that. Is that the mastectomy is performed and the implant. Now, warranting, the surgeons find that as a patient, they're in a position to follow through. The implants will be placed in that day. There are also, expanders that are placed in, and then over a period of time, and they're placed in just to stretch your skin and prepare the area for the implant. And there's so many theories on that I don't judge. If I detect that a patient has gone in a certain direction and they're safe and comfortable and recovering and optimistic, all is well.
And it's interesting listening to that because in my family background, my grandmother had breast cancer. This is back in the 70s, right before I got married, and she had one side mastectomy. And I recall, because back then they didn't do what they do today. They didn't have those practices. They didn't know. And that whole process and living with that for the next 5 or 10 years was really difficult for my grandma, and to deal with the whole the garments and I don't even know how to describe it. It was horrible. It was terrible for her. And so she basically towards the end said, I don't care about the bra. I don't care about those things that make me. She was in her 70s. She was like, I'm done. Fast forward, my stepmother, Lou's stepmother, had it, and she went through the implant. Reconstructive both sides, but they did. I think they stretched it out, so it took some time. It was tough, but she was okay. She was a little bit younger, but fast forward a few years, and the implant leaked, and they had to go in and take it all out. And I mean, and now she wishes she had never done it. Well, hindsight's 20/20, but there are benefits and risks to all things. We know that. And so your thoughts, when you talk to women, who gives them the advice? Is it the doctors? Is it the advocates? Where do you find that stuff?
It's so interesting you say that, because when you're diagnosed, and you have to wrap your head around this whole sense of, of having cancer and your own mortality, because it's the disease, there's the cosmetics and what have you, and everything that's afforded to us today with the advancement of medicine, which is remarkable. But again, there's just, there's so many resources and choices out there. And that's why I always emphasize, the possibility, number one, the need to own decisions we make. But it is so beneficial. It's important, yes, but it's beneficial. Our gain in taking a breath and understanding our resources. And by the way, understanding our resources could be a conversation with a family member, follow-up conversation with our medical staff. And by the way, you want to get second opinions today. We're so fortunate that we have that available to us, hopefully within our networks, but it is really imperative to connect with your professionals. If it really puts us in our safest spot if we have a relationship with our doctor. And again, we don't want to abuse that where, today I have, cell phone numbers for doctors. I don't abuse it, but I'm honored and I'm privileged that they're like, hey, Sal, here's my cell phone, because there are moments that I call. But you want to really, really trust your and have a relationship with your doctor, because too many women, and I'll even broaden that to men, patients, if you don't trust, your doctor, there's someone else out there. Even in my circumstance where you have a highly irregular stage 2 ductal carcinoma, gotta go, clock is ticking. I know it's ticking, but maybe that resonated with me too much, because in that same period of time, there's other professionals if you are not comfortable to speak to, and that's important. I didn't end up with the same, plastic surgeon. He did my surgery, but I never went back. Not saying he's, Harvard degrees and, accomplished just a very accomplished man. I respect him. He and I did not connect, and that's important. And, for a long time in my life, if I didn't connect with someone, I always read that and as it was my problem. What didn't I get? Why don't I care? Why don't I trust? It's because I have my own sense of who to trust and how to manage something. And when I own that and connect with someone who respects me, by the way, who will challenge me at times, we're not always right, but to have that open conversation is healing. In any situation we are, that we are in our lives, to put ourselves, in a space during a process with someone, who we respect, as not only a professional, but just as a human being. So it's, I'll go back and say a second opinion, or reaching out to individuals, what was your experience? What do you feel? Why do you feel that way? Oh, now I get it. They just didn't get along.
And I'm glad that you listened to that what you could call it, the still small voice, or for me it was the pink flags that I didn't listen to, that probably were red flags that I should have trusted my gut. But I did have another guest months ago, Christine Handy, and Christine, very similar, went through the surgery but trusted the degreed surgeon, and then realized later on that was not the person she should have believed. In Christine's situation, she was an international model, lovely personality, lovely person, but at the time saw more value in the body and the image and that kind of stuff. So that takes a hit. I'm looking at you. You're a beautiful woman, and I know at some point you're thinking, what is this going to do to the way I look? So
I felt that way immediately, and I say that I stand tall, and I say that very proudly. This sudden experience and diagnosis, and and this immediate lack of control that can if allowed, it will linger. Any lack of control over our bodies. I have always, since my childhood, I was raised. I'm a family of 7, and we were, we're athletes. We were raised. I was always among athletes. I was always on, a team since childhood. But my point, and I always felt like I was I was healthy. So I say that proudly. It meant a lot. And by the way, there was a ton of chaos when I had oncologists and breast surgeons trying to save my life, and I'll just share this one experience that I don't think many people have had, but I pushed so hard, and I guess I was frenetic at that moment. I was exhausted. There was confusion and anger and resentment toward what I was going through, and I had this overwhelming sense of like uneasiness during all this fear I was carrying. But I was having, when I got through the mastectomy and they put the implant in my right breast, which is where I had the tumor, and I said, we'll manage the left breast after. Well, I got out of surgery, and when you're saying, I was looking at, oh my God, I was just facing life and looking at the mirror, and I said, oh my God, no, I need to have the other breast done immediately. And I wasn't going to wait the 8 months through my prescribed chemotherapy. So if I look back on just the frenetic conversations I had with my doctors, and I believe that my breast surgeon, not the plastic surgeon, was placating me, but with skill at the time. So they allowed me to schedule surgery about a month later and to go in and remove that left breast. And I get to the hospital here in Jupiter with my husband and my sister. And I'll never forget, they got me prepared, and I wasn't in foreign territory. Now, I had never had surgery or been in a hospital in 54 years until I had my mastectomy and the tumor removed. But they prepped me, and I'm IV'd and everything. And my breast surgeon walks in and asked to speak to me privately, and he just looked at me and he said, Sally, doing this surgery is really creating a high-risk situation for you. You need to start your chemotherapy. Mm-hmm. And that man, and I do believe that it's because I trusted this man. I was calm. I could see him clearly. I could hear him clearly in that moment. And I really respected, and I believed that he was saving my life at that point. So literally within 30 minutes, I was unhooked and everything, and I went home. That's a pretty bizarre situation, but I own it, and, and I can talk about it, but, I can also use it as a point of reference. And, what can happen when we are so overwhelmed and uneasy with ourselves. He allowed me in that moment. I wasn't feeling so isolated and alone. I mean, I believe he understood me so clearly at that moment that I heard him, and I trusted him enough to follow the process. We were not on Sally's timetable. It was not about how quick I could get for, my body to look and feel normal. I had to have every bit of treatment before I could even get to that chapter.
The word brave comes to my mind.
Oh, yeah.
I'm thinking it was brave of him to have done that, and I'm grateful that he did, because many people might not have done that. They would have just said, well, we're scheduled for surgery, let's just do it. But he had so much respect for you, too, as a person, and the respect that you had for him, that you listened, because I think in many times of crisis, our brain just tunes out.
I also feel if we were to carry, and now just pull that word control out of our conversation, Deb, I find that the more confident, successful, and I don't just mean professional, I just mean, whatever they choose to do in their lives, but the more confidence that a woman carries, the greater the fall when they hear those words, you have cancer, because this is a moment. I really, you're in foreign territory, you don't have the tools to you're just totally in foreign territory. So like you asked earlier, where do you begin? Well, there is a process, but until you're able to calm yourself down, after you allow yourself to be terribly frightened and angry and whatever that encompasses, you actually have to, for your own well-being, set a boundary and try to calm your mind and reach out to someone. And that someone may not be in your immediate space to do that. And I don't want to get scattered, but I don't want to lose thought, because that reminds me of when I first published my book, I ran into a woman who had seen an article with my picture, and we happened to be women who took, Pilates classes all the time, but we weren't personal friends. And she walked into the room and said, "My goodness, I saw the article, and I can't thank you enough for writing it, because I lost my husband to cancer. I was his caregiver, for many years, but a horribly, challenging last year. And because I am, I'm a very successful professional, and I've managed life and taken care of my children and who I perceive myself to be in the community, I felt safe to talk to no one, because that was indicative of a weakness." Mm-hmm. And your story, of life beyond breast cancer, or what I perceived, that was my starting line. That's where I made I was able to, that crisis allowed me to make a shift in my life with my behaviors. And that amazed me, because it's interesting that you really can't predict who you're going to, reach out for, because the conversations that I have with these women who are just, they're lost. But by the way, they're allowed to be lost. They just learned, that they have cancer. They are terrified for their own mortality. And they just, but I do find if I just provide a safe space and I earn their trust and they can just talk, just let it go, that I have the skills and the experience to extract something out of that information that they're sharing with me to kind of hone in on and speak to with them and let them take the lead in the conversation. And God, suddenly you realize that, oh, okay, that is a resource. No, I can make the call, but no, I'm not quite ready to make the call, but I do know I can ask my husband to make the call, or my sister. There's so many possibilities, and once we've calmed ourselves enough to realize that, we can put the car in gear. We can go.
Can I ask you I want you to speak for others now. How did Jay and your family members react to this? What kind of a support were they? And I know them, many of them personally, but I'm just curious how people react differently, because we're all controlling people, and now none of them are in control.
Well, my husband, who's by his profession, is a psychologist, but organizational. So, but of course, his training is in psychology, so that was interesting. But as my husband and my best friend, you make me cry now. He was broken. He was broken.
I'm sorry. I love Jay.
No, yeah.
But I'm curious because
you're at a moment. You're at a moment that you've got a person you love that may not be here tomorrow, and you literally everything you do in your life, we have an answer to, right? We all wake up every day and said, "Oh, we're going to manage this." I get it. I get it. I'm in my 50s. I'm in my 60s. I could be in my 20s, We either, with our own behaviors, we just do it. And by the way, I have a cousin, Liz and Gail, on the phone that were amazing. Catch my breath.
Well, I'm just curious, did Jay allow you to make the decisions, or were that made together?
That's interesting you say that. No. But I believe he was just trying. I don't think he was being controlling. He was being helpful, but Sally's perception was he's controlling it. Mm-hmm. But he was because, by the way, we're in two different lanes dealing with the same crisis, okay? Mm-hmm. So my husband's approach to life is he looks at something and let's go. Here we go. I get it, but I got to kind of look at the entire view and feel safe with everything. So there were many times, especially the breast surgeon, that I never used again, because every time we walked in, it was a conversation with my husband about life and doing this and that and, and making decisions for Sally. But you know why Jay made the decisions for Sally? Because Sally wasn't speaking up.
Yeah.
At that moment.
And is that an aha moment for you that in this particular case, you say, own the story, own what's happening, and speak up for yourself.
Yeah, that was my trigger. That was a trigger. It changed many dimensions in my life, probably all.
And I was interested too, as looking over your life and listening to some of the information that I've listened to about you in the last couple of days. I was just wondering, was this the point where you, quiet middle child, now is standing up in your power because it's your story now, and it's your time to take your pain and make it your passion and your purpose, and you do it with grace and joy, but also with experience, and that's what I think.
Correct.
In a support role, that lends such credibility when you've been there and you can say, I know how you feel, and really know how they felt.
Right. Well, I say, two things I say, and most importantly, life is a feeling. Until someone, including ourselves, is in a moment and experiences it, and most importantly, by experiencing something, you have to feel it. That's the sense. Okay, that is the greatest sense that awakens at that moment. Once you feel something, you get it. So you can choose to like it, dislike it, act on it, ignore it, shut it out of your life. And that was the trigger for me. And another, and then I also realized, and maybe that experience taught me, is that because I always felt like, things weren't easy, like it was chaotic, like I had too many choices. And and it was, everything was always a challenge. Like, my first thought was, oh boy, this isn't going to be easy. I think what I realized is you can simplify it. So no, it's never going to be easy, but we can simplify a process by going at our own pace. And I tend to be a feeler. I'm a feeler and I am a doer. I go and I go and I go. But I've allowed myself to be, to really act on my feelings. And I do believe, as you asked, that was my trigger. Cancer was my trigger.
Why did you write your book, Live Like Crazy?
Because I wrote it, most importantly, and it's interesting because as I was writing my book and working with an individual, and I truly wrote, I wrote the book, I would feed my notes. But, we were just having kind of easy conversation one day, and I'm like, so who's going to read the book? Just in one of those moments. And he's like, Sally, oh my goodness. He said, just think of that woman who may just not have access to resources or, most of us, hey, we're all online today. We're all on the phone. We have technical abilities, and we manage to navigate our way through communication today. There are a lot of women who not only don't have that, but don't have the wherewithal to speak up.
Ooh, did we lose Sally? I think we might have lost Sally. She's going to have to come back on. In the process, guys, go to livelikecrazy.org. That's Sally's website, and you can email her at livelikecrazy@gmail.com. Look at her book and look into it. It's called Live Like Crazy, and it's My Will to Heal, and it's healing with somebody else. Having that second, for me, it's the handhold. Having someone to hold your hand and to keep going along with you, because you can't do this alone. And you may try, and you'll get stuck, and then you'll get in despair and depression, and you won't know where to go from there. This has been an extraordinary conversation with Sally. I do have some family members here. Thank you for being here, and I have some survivors of relationship fraud here. But all of us, I think, have been touched by breast cancer in our families or in our friends. And I was wondering if anybody would like to come on and share.
I'm Liz, and related through marriage. I am actually a 3-time breast cancer survivor and was originally diagnosed at 38 when my kids were 3 and 8. Everything that Sally is saying just resonates at every single level for me. I was a young mom. And I was silent. Nobody knew. My family knew. I was embarrassed. I was it was like I lived in a very small town, and I didn't want anybody to know. It's like almost like I was a failure. Like, oh my God, what did I do wrong? And that was the first time in 1998. And 2 years later, my every single thing about how I managed living with breast cancer changed, and I became an advocate, and I became a fundraiser, and I'm, a number one fundraiser for making strides against breast cancer year after year, and helping people, talking to people.
Wow.
It's just everything to me, the support. And so when I, read Sally's book and learned Sally's story, and just the advocacy it's just so remarkable. So,
So Liz, looking at the dates, you had breast cancer prior to Sally?
Yes.
Did you say anything to the family?
No.
Because I did see later on after Sally's diagnosis, there were 5 others that were diagnosed.
Right. And actually, I was not married to Michael at the time, so it was, kind of my former life. So yes, Michael knew because he was very much in my life, but I wasn't integrated into the family the way I am now.
Actually, Sally's back on, so I'm glad you're back on. Sally, I brought the family in to get their take of the story, and then Liz was just telling me about her experience as a young mom and not speaking up. And I read somewhere that after your diagnosis, you had 5 other people.
There's at least 5 of us within a 10-year period, first cousins on the same, within the same family line that have been diagnosed.
So that's why it's so important when you go in to have a yearly mammogram, when they start asking family history, it's really important to know that family history besides your mother, right? Because you're multi-generations here.
It's so important, and I reach out to family often. I not only value knowing when you were diagnosed, but your pathology. And please, if you can, access your pathology, send me a picture of it, because I want our daughters, or our sons, because we have colon cancer. That's one in the family.
We've got that male breast cancer.
Right. So I believe as a whole, medical history to a family, whether it's cancer, heart, whatever, diabetes, is so important. And the exact, because I don't know of the other 5, but I am a triple negative survivor, which, on the front end, at the moment I was diagnosed, the treatments were chemotherapy, radiation, and then, a medication post those treatments for 5 years, the oral medications. Well, not so fast, because when I was diagnosed in 2011 then with triple negative, my hormone, that really, simplifying that is my hormones would not be receptive to any treatment but chemotherapy, and hopefully chemotherapy. And so that's, and then again, there's a 2-year survival rate after that chemotherapy, because your body won't react to any post medications, where your oncologist follows you so closely, because that's where we can, you can lose the fight. So it's interesting. Now, there's been so much advancement in medicine since that point. So today I belong to triple negative, networks, and I'm just so grateful and fascinated by what is available today, and even on a preventative measure. But the fact that 5 of us have had it, and, even, Liz, because she's, center in our family, it's just anyone who has information concerning the pathology or has knowledge, it's so important for all of us to have that information at our disposal, filed somewhere.
Well, and I'm thinking, too, of young women who've been adopted and, didn't have contact with the birth mother. So it's important to have that information, because otherwise these girls are really flying blind.
Our doctors are operating on, information and pathology that we can give them. That's factored in to how they evaluate a patient and pathology to prescribe a treatment. And the more information they have, the more power they have.
Right. Thank you so much for all that you're doing, for being the advocate, for standing up and speaking up. It's important, and it'll save a life. Thanks for listening to Stand Up and Speak Up. We are dedicated to encouraging you to remove the mask of embarrassment and being your best self. If you've been a victim of a scam or cybercrime, please visit againstscams.org for assistance and guidance about options in recovery. SCARS, the Society of Citizens Against Relationship Scams, is an incorporated nonprofit crime victims assistance organization based in Miami, supporting scam victims worldwide. If you can, please make a small donation to help the victims around the world receive the help that they need. This episode has been sponsored by BenfoComplete.com, a vitamin supplement company that supports happy and healthy hands and feet for those with neuropathy. If you or anyone you know struggles with the pins and needles or numbness in their hands and feet, check out our benfotiamine products at BenfoComplete.com and use the special code STANDUP for 5% discount on your purchase. Again, thanks everybody for being here with us today. Go to my website, thewomanbehindthesmile.com, for additional information and resources. Check out my YouTube channel and subscribe, and follow the replays of all of our great guests. Have a great day, everyone. Thanks very much for being here.